Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Monoamine, first question. Monoamine oxidase inhibitors should be stopped. Monoamine oxidase inhibitors need not be stopped, they can be continued. Second, aspirin should be stopped how many days before surgery? Aspirin should be continued. There is no need to stop aspirin. Third, patient should be nil per oral for how many hours? Patient should be nil per oral for 6 hours. Fourth, in anesthetic practice, preoperative digitalization is considered in which conditions? So that means before preoperative digitalization is continued. That is digitalis is given before surgery for which conditions? If there is intraoperative cardiac failure, preoperatively we should do digitalization. For supraventricular arrhythmias, we can do preoperative digitalization, and for postoperative cardiac failure we can do digitalization. So preoperative digitalization is done on intraoperative cardiac failure, supraventricular arrhythmias, and postoperative cardiac failure.
thank you and thank you for watching.